What happens when two of the most plugged in people in digital care get together to help you begin to make sense of some of the chaos? Welcome to Control Plus Care. I'm Michelle.
And I'm Katie.
This is your weekly briefing on the most up-to-date news on digital care. We're unpacking what you know, what you didn't know, all in under 30 minutes. First, Katie, in person, how are you?
I'm pretty good. First in person ever. It's
Yeah.
been interesting getting the setup all right.
Rihanna's a trooper.
Rihanna is a trooper. We are in the world's warmest room.
Yeah, we are on the world's warmest day.
Exactly. But we're here in person, so that's always a bonus.
Yeah, it's really nice. So I'm really pleased. And we've got lots to talk about today.
So much. You would think in the summer things would be quietening down, and yet just more and more stuff appears to keep happening. People just keep going on.
I keep telling people the summer's always quiet for us. It turns out I'm just becoming a bit of a liar.
Yeah, I think we just have to stop saying the Q word. Every time we do, it doesn't work out well for us.
So last week was great. We had our first guest,
We did have our first guest, Cyber Sam.
Cyber Sam, who we love. He is, honestly, we work with Sam so closely and he keeps us on the straight and narrow. He is always there to remind us of our own cyber hygiene, let alone the rest of the sector. And it was just really great to hear him talking about the thing that he is so passionate about.
Yeah, and just making it really, really simple as well for somebody who's so technical in his background. I think it's actually quite rare to be able to communicate as clearly as he does about really technical topics.
I've met a lot of technical cyber experts.
Mm-hmm.
I've understood few of them. So it is really nice to have someone who just has a natural gift for translating really complex things into things that we understand. So that's great. We also survived our first week where we did not mention AI once.
Yeah, exactly. I still think we need some kind of AI klaxon, because we are going to mention it.
Yeah, we're not going to get away with that every week. In fact, I think it's going to be a while before we try it again because there's so much AI news coming out.
Yeah, exactly, which we would expect as well. It's sort of one of the fastest developing areas. There's new use cases happening all of the time. Every time I speak to a care provider, they're telling me about a new thing they're doing with AI. So we're not going to avoid it completely. We just didn't want it to be the only thing we talked about on this podcast.
No, not in the slightest, but it is something that we're going to come back to. And in fact, today I think we are going to start with some really big AI news.
Yeah, absolutely.
So for those of you that are in the know and that have already had a little play around with it, ChatGPT 5 has now launched. That launched last Friday.
Mm-hmm.
And according to Sam Altman, it is the smartest AI yet. It is at the level of a PhD. And by all accounts, it can do some incredible things.
Yeah.
But it's not gone down well.
It hasn't. There's been quite a lot of pushback from people who love ChatGPT and OpenAI. There has been a lot of people very upset because it feels less personal to them. People who really feel that their AI is not just an AI tool, but is a companion to them, has a quirky personality, has somebody who they sort of almost rely on as a support.
And there are certainly people who've taken it further than that still.
There is, yes. So I was saying to Michelle before we started recording, our colleague Dan told me earlier this week that there is a subreddit, which is for people who have AI as their girlfriend or boyfriend or life partner. Over 12,000 members of this group.
I mean, as someone who's been married for 7 years, I see the appeal. I'm not going to lie. The person doesn't actually live in your house. They only ever respond really positively. But it does make me real worried. Like, I talk about this all the time when it comes to tech. I talk about the fact that the thing that can't be replaced is human empathy. The thing that we have that is our real capital in social care is the compassion that we give. And no amount of AI is going to be able to replace that. And yet, there you have at least 12,000 people who feel like it does.
Yeah, and I have to say, I'm so not proud of this. My sort of first instinct was to go sort of full older person. People need to go outside and get a hobby. They need to talk to people, which I appreciate is not a good instinct.
No, it's not. But I think I'm always, when it comes to AI, going to come back to AI should supplement people. AI should do the things that we don't want to do. And I don't want AI to be my friend. I want AI to do my shopping list and AI to order the online shopping so that I can spend time with my friends.
Yeah, exactly. And that's why, for me personally, I prefer my AI to not have any personality at all. But for those people who do like the AI to have a little bit of personality, they have rolled back some of the features for GPT-5. You can now choose which model you'd like to use. And there's a lot of more functionality around making it more personalized. I think it's just something that we will need to keep a wary eye on. We don't want people to be having their only form of human
Yeah.
contact. For people just listening and not watching, there was strong air quotes around the human contact there, to be from a chatbot at the
Yeah.
end of the day. So really, really interesting developments.
Yeah. And I think mindful for us of the people that we support in the sector and also our staff.
Yeah.
This is the kind of thing that, we want to be watching out with staff as well and keeping an eye on, people whose behavior maybe is shifting and changing as we would with any sort of social situation we find our staff in. But interesting that ChatGPT went and rolled back so quickly. This only launched on Friday. Uproar happens over the weekend, and we're recording this on Wednesday, and already they're making changes.
Yeah.
That's the speed of change we're talking about with AI, and I think that's why it's going to continue to come up for us all the time.
Yeah, absolutely right. And I think, if we're taking a positive from this, the fact they're listening to user feedback for a software company that massive, you do need to give people sort of kudos for that.
It's Virgin on co-production.
Merging.
Virgin, just I mean, for Silicon Valley, I'm going to take it.
Yeah, exactly. So we do have more AI news as well. This one is a little bit less light-hearted, unfortunately. So this is an article which appeared in The Guardian this week, which is all about a report which has come out from LSE, London School of Economics, their Care Policy and Evaluation Centre, which has been evaluating gender bias in open source AI. So they've looked at Meta's Llama 3 and Google's Gemma, and kind of explored, is there bias between men's health records and women's health records based on AI case notes and summaries? And they found that it's sort of dependent between the models. So Llama 3 didn't show any gender based differences, which is great. But Gemma did display the most significant gender based differences. So, what they found was that male summaries focus more on physical and mental health issues, and language use for men was more direct. But women's needs were then downplayed quite often in summaries. And I think the thing which the report really pulls out, and if I'd recommend the article, but also the report has a really good abstraction summary to
Yeah.
read, is that where care is so sort of situational and means tested and dependent on your ability to advocate for yourself, if you've got summaries which are downplaying women's health needs,
Yeah.
does that mean we're at risk of women not receiving the sort of funding and support that they might need?
And the thing being, we are seeing more and more local authorities really advocating for this idea of predictive modeling, advocating for the idea of aggregating large amounts of data to make care decisions.
Yeah.
And if in such an early stage as this, we're already finding that bias. And you and I have talked about it before. When you have AI, which is largely created by men on data sets which are largely male led, what you're going to have is that bias baked in and you can't roll it back.
Yeah.
You can't fix all of that training data. So it is a concern, and we should just always be asking the question. I think that's the thing for us all the time is asking the question, like, how good is the data that informs the AI? How good is the information that it is giving us? And this is where we always need people who understand what they're looking at and can make these comparisons.
Yeah, exactly. And so this is a piece of research the Health Foundation did, I think last year now, so it's a little
Mm,
bit older, where they looked at public and NHS staff attitudes to AI. And they saw massive distinctions between levels of trust between men and women in that research. And women in general didn't think that AI was going to really help support their care outcomes
mhm.
comparatively to men. So I think that also shows there's something we need to do around maintaining trust for
Yes.
people. And the way that we are talking about this is going to be really important going forward. So it's not all bad news. The full report from LSC also has an actual evaluation framework of how you can work through this as a local authority or as a care provider to assess potential bias, to really sort of go, is this tool that I'm using the right tool for the people that I'm supporting?
Yeah.
So there is a positive there.
Yeah, and I'm glad to see it because it is so frustrating. We are a sector that is constantly battling bias in many, many different ways, and to see this in what is, and a huge opportunity for the sector. We talk to providers all the time who are like, "How can we do this? How can we implement it? How can we make AI a part of our service?"
Mhm.
And if what we've got to offer is actually more damaging than good, that for me is just a big alarm bell.
Yeah, exactly. So it's good, I think, though, to see so much research coming out so quickly.
Yes.
So we now have the work from the Health Foundation, we have this work from LSC, there is more work coming out around sort of AI and care all of the time. The work we've done with the Institute of Ethics and AI at Oxford University, and practical tools and resources as
Mhm.
well. So, yeah, don't want to be completely negative. We're
No.
very keen to not be all AI naysayers on this podcast. But it is a really important article that's come out this week. So do make sure you look at it.
So we're going to move away from AI next,
Yes.
but we are not moving away from doom and gloom. Uh, unfortunately. So on the news stories I spotted this week was unfortunately a really significant cyber incident that's happened in health.
Yeah.
So it wasn't in the UK, it was in the Netherlands. But the details of 500,000 women who were taking part in a breast and cervical screening program in the Netherlands was stolen. For those of you that you haven't seen me waffle on about cybersecurity, I will always tell you that on the dark web, health data is worth 10 to 40 times more than credit card data.
Oh my God.
Like, because I think about my health records and I think, I don't care that I've got a antihistamine. I don't care that that I've been to the GP for a sore ankle. But actually, if we think about data as a mechanism for fraud, for
Mm,
building an identity of a person, your address changes, your credit card details change, your bank changes. What doesn't change is your health data.
yeah.
That is a from birth record of who you are. So that's really concerning. Now, the organization themselves took a really, swift steps. They have stopped the screening program for the time being, which on the one hand, great, that's preserving that data, but that means all of these women who were due to be screened is now not happening.
Yeah.
And we saw the implications of screening programs being halted during COVID.
Oh, yeah, absolutely.
No, so the disruption of this incident is enormous. And always we are talking about business continuity in these circumstances. We're saying to providers, make sure that you've got your DSPT, make sure that it's up to date, and more importantly, make sure that you're actually implementing what's in there, because
Hmm.
that's the kind of thing that will help protect your organization from incidents like this happening.
Yeah, absolutely. And I think also, apparently, an emerging theme of this podcast episode is the importance of trust.
Mm,
These big, big cyber incidents, these big breaches, really do impact the trust of people
yeah,
to, be part of research, be part of big sort of data repositories. The vast majority of people in this country trust the NHS to hold their data.
yeah,
But the more you have breaches like this, the more we limit that trust. And it's so important that, health and care professionals, regardless of role,
yeah,
have access to the data they need to provide that care. If people start wanting to pull that back because they don't trust the system, that can only have really poor consequences
yeah.
for people at the end of the day. So, really important to be thinking about this sort of from that trust level, as well as just your day to day organizational running, I think.
Yeah, absolutely. And I think, we know that the future of care and the future of health is in really high quality data.
Mm,
It's in being able to take data and make really accurate predictions about the care that people are likely to need further down the line and the things that we can do now to prevent people needing more care. And all of that relies on, as you say, people trusting the system enough
hmm.
to hold their data.
Yeah, exactly. And I don't think we really went into it lots in our 10-year plan episode, but that is the direction of travel,
Yeah.
isn't it? All of the predictive genomics, for example. But if we don't have a citizen who trusts that the government can actually keep their data safe when we're talking about the antihistamine that they're on,
Yeah.
are you going to trust a large organization like the NHS or like the government to keep your full genomic
Yeah,
data?
your mapped genome is
Yeah,
as personal as it gets.
absolutely. Yeah. So big questions from this sort of thing.
Yeah, and something that I think we will come back to on this podcast time and time again.
Yeah, almost certainly. We're going to have some recurrent themes.
Yeah.
Yeah, multiple klaxons, the AI one, the cyber breach
The
one.
someone's just a really loud bell that tolls. Rihanna, please source us a giant bell.
Yeah, that'd be really good. Some kind of soundboard, maybe.
No, we can't be trusted.
We would
We
not be trusted
cannot
with
be
a
trusted.
soundboard. Absolutely not. So, on a more fun story, I think, well, fun slash terrifying, dependent on where you are.
I'm sitting on the dystopia, but you go ahead.
Okay. So, we're talking now about something called Figure.ai, which is a combination of robot and AI. And it's a big process to try and create a robot who is completely self directed, who can be a robot who is there at work and also in the home. And this week, the Helix version of Figure has been able to fold laundry under its own powers for the first time. The press release for this says it's the biggest innovation since the dishwasher. So quite a big move here.
I mean, that's a big claim. I, as the mother of two small children, am all for anything folding my laundry.
Mhm.
But at the same time, there's just something that doesn't sit right.
See, for me, I will be really excited about it when it moves beyond folding laundry to be able to put it away.
Oh, that is the job.
I'm fine with folding my own laundry, but everybody has the chair right in their room, which is where the clean laundry goes. It's folded.
Well, it never makes it to the drawer.
Exactly.
Yeah.
So when it gets to that stage, I mean, I sort of feel a little bit like the Jetsons is coming to life and we can all have Rosie the robot.
See, this is the thing. We all think that we want robots in the future.
Hmm.
And here's my problem. I don't want that robot to be a woman because I don't want a woman being subservient. I think we're already on slippery slopes with that conversation. I also don't want another man in my house.
Yeah, you already have a husband.
I already have a husband who can fold the laundry but also utilizes the chair.
Hmm.
So for me, I'm like, can we just not think a little bit further outside the box? And when I design my dream robot, it's an Ewok from Star Wars. I don't know why, but it's
Mm.
cuddly, it's cute, it's, Android-like. It's also very short. You know how I feel about short people. So I
Yep.
would feel comfortable with a very small person living in my house.
Hmm.
Like, can we just stop? I mean, for anyone who has seen it, it is iRobot in black.
It absolutely is very iRobot.
Mhm.
It's quite militaristic, I think, in terms of some of its construction.
Yes.
Um, I mean, my main requirement for any kind of robot like this in the house, as somebody who won't even have an Alexa in the house, and this is a stretch, is that it can't scare my cat. And she is scared of
Um,
everything. So,
and then in social care, that's exactly what we should be thinking about. Imagine unleashing that on a dementia village.
oh gosh,
Like
I
an
know.
army of.
Terrifying cyborgs.
Yeah, there was. I would advise. We'll put the link in the show notes. But go and have a look. There was like a scene, and it was a moment when three of them turned, and that was when I was like, nope, nope. They're gonna come and kidnap me in my sleep.
But if three of them could be a dance troupe.
But a dance troupe that looked like Ewoks.
Okay, yeah, this is the thing.
See,
So basically, we're putting our pitch now to this company. We have some design suggestions for you.
I'll mock up some sketches. / get someone else to mock up some sketches.
I was going to say, are you creative?
No, I'm not even slightly.
No? Okay, sure. But it's still, I think especially Vic Rayner from National Care Forum, talked to her a lot. She's very excited about
She
robots.
likes robots.
So this, when I saw it, I was like, this is going to be right up her alley.
Also, Lewis Sheldrake from PCN.
Yeah.
Yep. Also, PCH, sorry. Very big fan of robots. So people want robots. I just don't know that I want this robot.
Yeah. But they do have a very good and interesting press release. It's quite funny.
Yeah.
Would recommend looking
Watch
at
the
it.
videos.
Yeah. Which feels like a good segue
Mm.
into our newest segment of the show.
Cyber squirrels.
Cyber Squirrels is back.
So every week, Katie and I go on a little hunt across the internet for the funniest, just general tech stories because we are recognizing that we at least are starting these episodes on a little bit of a sour note, which we don't want.
Mm-mm.
So I went off and having seen the robotic story was coming up, and I was like, oh, there's gotta be a robot fail.
Yeah.
And the internet did not disappoint. So in an office building in Washington, DC, they have security robots,
Oh.
which kind of patrol the lobby and watch out to make sure, kind of stop people and record people's faces to be like, you're not belonging here, whatever. And one of them ended its own life by plunging itself into the fountain outside the building
Oh my God.
because even robots hate Mondays.
Fair. Absolutely. It just threw itself into a fountain.
And nobody can understand why, because obviously it was geofenced, so it shouldn't have
Yes.
been able to leave the building. It certainly shouldn't have been able to go down the steps and over the little wall into the fountain.
It just decided to do that.
Yeah,
Wow.
but they watched the video. It wasn't, they were like, a person has chucked that in. Nope.
Yeah.
Robots took it upon itself.
Just decided it was done with corporate America. It's August. Should be on holiday.
Exactly. I don't blame him one bit.
I know. I feel like I also have a story for my cyber squirrel about technology who just decides that it's not good at its job and packs it in. So this was from a software computer science student who had been using an AI to check his coding. And posted the full screenshots of what the AI was saying. So he leaves it running, says, can you debug my code? And all of this comes back and the AI is like, yeah, been searching here and searching here. Think it's been fixed now. I will rerun. And it does it. And there's still a bug, an error in the code. And it keeps going until the AI basically has such a meltdown, says that it's completely useless, that it will never be able to succeed at coding, and just says 86 times in a row, I'm worthless.
I mean, I am calling for tech to be more human, and what is more human than an abject fear of failure?
I mean, for me, what I thought of is, Hitchhiker's Guide to the Galaxy?
Yes.
You got Marvin the robot.
Yeah.
He's the smartest robot on the planet, but is incredibly depressed. I'm like, oh my goodness, have we invented Marvin?
Oh, it was only a matter of time.
I know, it really was. So don't worry, the AI has recovered, and also I believe that the student has fixed his code. So
Oh,
it's not the end of the world, but just, it was an incredibly human response.
Yeah.
We've all been at that point, if you're a student and you just can't finish a project, you're just like, I'm just going to switch it off.
If anything, that's what makes me kind of confident we'll reach the singularity.
Mm.
Is like just the depressed, unhappy, miserable.
Oh.
Like if you can really do human misery, then you're capable of thought and feeling.
Yeah, exactly. So our good news story is ending on a sad note this week.
We're gonna right. We did an AI ban.
Yeah.
We're gonna have to do a bad news ban.
Only good vibes.
Only good vibes. It might not be next week.
No, maybe for the bank holiday week. It's a short week.
Okay, yeah, can't be much bad news then.
No, exactly.
She says, touching wood.
Touch wood.
So that's us for today. Please do come back next week and we'll be discussing the latest in digital news and care. So what happens when two of the most plugged in people in digital care come together to demystify digital? You get control plus care.
Subscribe now wherever you get your podcasts. Everything that we've mentioned today will be linked in the show notes.
And tell a colleague, especially if they're emotionally enmeshed with an AI.